On a daily basis, while interacting with patients, we come across such sometimes funny but real world scenarios which none of our books have taught us, neither they have been explained to us by our seniors or by our teachers. I would like to give you one instance which came across a couple of weeks ago. There was this gentleman in his late 50s, diagnosed as carcinoma of the large intestine, and a very educated family. This gentleman himself happens to be a manager in a nationalized bank based at Nasik, and he was diagnosed with colon cancer, diagnosed at a very early stage, went through the surgery, and after this it was a robotic assisted surgery, so within 4 days he was back home, and he came for his first follow-up, and I was very clear to explain him, considering the early nature of his disease, he did not require any chemotherapy nor radiation, so we had kept him on a surveillance protocol, meaning that he needs to come and show us once in 3 months for the first 1 year, and he is expected to be back to his routine, normal diet, obviously with little more added veggies and fruits, and a daily routine of exercises. And with that explanation, I explained his wife who was with him, and his kids were also there. His son was working in US, settled over there. His daughter, who flew down from Canada, she was settled there after her marriage. So that type of a family scenario which I'm relating to. And just on a casual note, I said, you are back to normal, and you should thank Almighty that it's just within a week after you've been diagnosed, your treatment is already complete and you are on the path to normal recovery and a normal life. 3 months later, when this gentleman came to me for a follow-up, I noticed that he had lost weight. He was definitely looking a little sick, and he was accompanied by his wife. Kids were back to their routine. I myself was alarmed and concerned because that was not what I expected from him, considering the disease profile which he already had. While talking with him, I said, what are the concerns? He said, I have significant loss of appetite. I don't feel like eating. I have nausea. I have a persistent headache, and I don't feel like going to the bank again. After you gave me a fitness certificate, I went to the bank for a couple of weeks. Then after that, I have taken again sick and I'm at home. His wife had to say that he does not talk with me also. He remains secluded to his room, does not like to listen to music or watch the TV also. Maybe what was going in my mind that probably there's some metastatic disease, or whether the disease has come back in an unexpected area. So I had asked him to go through a CT scan and some blood investigations. Within an hour, he came back to me with all the investigations which I had advised, and surprisingly everything was normal, absolutely normal. So the only thing, if all the blood reports are normal, CT scan is not showing any evidence of the cancer coming back again, then what has been the precipitating factor for this gentleman to lose more than 4 kg weight in last 3 months, and for him to feel so low was definitely a clinical dilemma. I tried to talk with him, but when I could not really bring out the truth, I asked him to meet my psycho-oncology team. So he, along with his wife, they went to the psycho-oncology team, where both of them were interviewed, and a discussion was done jointly as well as individually. After about 2 hours, my psycho-oncologist get the patient back to me, and I noticed that there was a stark difference in his personality now. He was much as if he had removed a whole load of some weight kept on his head, and he was sitting with a little smile on his face. He said, I am fine now, sir. I think I should be able to regain my weight, and next time when you see me, you'll see me much fitter, and please ask your secretary to give my fitness certificate. I'd like to go back to the bank tomorrow itself. For me, it was like a magic wand. I asked my psycho-oncologist, what have you done for him to change his entire approach towards the way he was talking with me 2 hours ago and now? She said, nothing great, sir. While interacting with him, what made him feel low was my question. And the patient said that I know I am not going to get back on the path of recovery. My days are numbered, and after the cancer, it's just a matter of few months left for me. So why should I go back to the bank, or why should I lead a normal life? So she asked him, what makes you feel that your days are numbered? Because you have a cancer which is stage 1, where the probability of recurrence is less than 1 or 2%. Then what makes you feel so? Then this gentleman opens up and says that although he has been blessed with kids who are settled abroad, but unfortunately he has had a troubled marriage. For last almost 3 decades since he's been married, rarely has a day gone by when he and his wife have not had a quarrel, or have not had, they've been not on talking terms for days or weeks together. But after the surgery, suddenly his wife has started talking very, very sweetly, she has developed a sweet tongue, she's behaving very well. So that is the reason this gentleman had a feeling that what has not happened in 3 decades, if it has happened now, means my days are numbered. That is the reason why my wife is talking with me so sweet. So I was short of words. I was just wondering how to react to this gentleman's feeling. But well, that's what a patient goes through. So it's like, the only thing which I told him that along with prescription for some multivitamins, I would prescribe your wife to please continue the daily doses of some quarrel which will make him feel normal. So human mind, it's a Pandora's box. What a patient or what an individual goes through can never be predicted. So it is important for us to have a good, healthy dialogue at any point of time. If you're going through treatment of patient and if you have any such feelings, you might be feeling that these are something very troublesome or very major issues, but they could be just a minuscule. Please talk with your caregivers, talk with your doctor, talk with counselors. We are here to help you, because like in this particular scenario, this gentleman, 3 months, he was sulking inside thinking that his days are numbered, but actually he's cured of his disease. So probably what I failed as a surgeon to advise him when he was discharged from the hospital was that you are free from disease physically and mentally as well. So please continue your daily routine as you are practicing. Please talk. I think communication is the best form of getting rid of majority of the misconceptions which we develop in our mind. Have a great day ahead.